Good evening. I'm Rodney Rogers, president of Bowling Green State University, and it is my honor to welcome you to our virtual town hall meeting for our newest students, for our returning students, and their families. So we are very excited that you chose to join us tonight in this town hall meeting. You know, it was back in March 9th when the governor of Ohio, Mike DeWine, had declared a state of an emergency, and since then we have been pivoting and adjusting and adapting, but at the core of it is ensuring that we are providing a very high quality educational experience for each of our students. Moving forward, we are just so excited to have our newest students joining us here in the next week, during this week, and then classes beginning next week, as well as our returning students to welcome them back to Bowling Green State University. Tonight I have three of my colleagues with me that would like to provide some overview of their various areas that they're responsible for, but to make sure we get to questions very quickly. Quite a few of you have already submitted some initial questions, so in some of these opening comments, we will provide some responses to those questions, but I ask you to continue to provide us questions. We want to answer those questions, and we will answer them the best that we can do. Now, as you know, we have de-densified the campus in general. We have used MyBGSU as our Design MyBGSU as a way to help students make a decision. So if you want to have a fully virtual experience, we are working with you to develop that kind of schedule. If you want to have a hybrid face-to-face experience, we are also working with you to achieve that. In general, this has reduced the number of students who are physically going to be on campus. Overall, we're about 29% of our students will have a fully virtual experience, either online or remote. We've also de-densified our residence halls, and I know some of you, we asked just a few weeks ago if you'd be willing to make some adjustments to commute from home or go fully remote or find some alternative arrangements, and that also has reduced the number of students living on campus. All of that is being done to minimize the spread of COVID-19 and to ensure for those students choosing to have a face-to-face hybrid kind of part of their education that we are prepared to deliver that over this next 13 weeks, which is between next Wednesday to the Wednesday before Thanksgiving. So with me is the Chief Academic Officer, our Provost, Dr. Joe Whitehead. Also our Chief Student Affairs Officer, Jody Webb, and our Chief Health Officer, Ben Beatty. And so I am going to pretty much turn this program over to those three individuals to respond to your questions, and I know they will also bring a great greeting to our newest students and the families of those newest students and our returning students as well. I look forward to seeing so many of you in our here at Bowling Green over the next week. Again, thank you so much for joining us. And now we turn to Dr. Joe Whitehead. Provost Whitehead.
Thank you, President Rogers. Good evening, everyone. We've been working very diligently to try and address the requests that have come in as part of Design MyBGSU, as well as the densification of our residence halls. And so we're not where we want to be, but we're making really good progress. Our advisors, our faculty, our staff, and our deans have been working to create classes, modify how classes are delivered in order to accommodate the students who would like to have a fully virtual experience. So again, we're not where we want to be, but we're getting very close to finalizing those schedules. Just a reminder, we're delivering classes in three different modes. One is the online mode, where a student could work at their pace as well as what time of day would like to work. We have the remote classes where the classes are held at a distance. They're online, but students meet with faculty at specified times. We also have the in-person hybrid courses, and those courses are scheduled at a particular time. Students are in the classroom, and there's a possibility that a student can participate remotely. So we're trying these 3 different modes in order to help students find and tune their schedules to be totally virtual, to be a combination of virtual and in person, or totally in person. And so again, we're working again to move forward in finalizing the schedules. We know you're anxious, but we're working as fast as we can, and we would like to for you to have patience with us. Another thing we're doing is we have looked at each classroom and identified the capacity for each classroom that will allow physical distancing in each classroom. And so by doing that, again, we are doing as much as we can to ensure maximum safety while in the classroom. So again, thank you. I'll be happy to answer any questions. And next will be our Associate Vice President for Student Affairs, Jody Webb.
Good evening. I appreciate the opportunity to talk with our new students, our returning students, as well as many of their parents and family members this evening. I want to take some time to talk with you about our campus life and what this is going to look like when you return to campus. It is going to feel very different. For those of you who are returning students and what you recall, there are going to be some significant modifications. For our new students, what you've envisioned, what your parents experience, what your older siblings experience, this year will be very different for you. Certainly we've talked about things such as the importance of face coverings, physical distancing, the fact that you're going to need to monitor your health on a daily basis. We've de-densified the residence halls. We've done the same thing in both classrooms and residence halls. It's also really important to note that our social groups, the meeting times of our students and what that looks like is really going to change. We are not going to be able to have some of the large events that we've all really enjoyed and have been so much a part of our campus. We are going to be, though, having some smaller events and small group opportunities. And so while your physical interactions will be distance, and we're going to be looking at small group opportunities as well as virtual engagement, it is going to have a very different feel on our campus. And we just want to make sure that you're very clear on that expectation. Many of you should have by now signed your community commitment. This outlined not only some of the things such as face coverings and physical distancing, as well as you may at times need to participate in contact tracing or testing. It's also really important to think again about the group size and how we're going to be less than 10 people in many social settings, both on campus and off campus. That's really critical. I do want to stress that it's incredibly important for all members of our campus community, students, faculty, and staff, to comply with our campus commitment. And for our students, I do want to stress that lack of compliance could result in a violation of the Code of Student Conduct. This extends to both on campus and off campus. That's not new, that was always there, but we will be working very closely with our partners in the City of Bowling Green and with local landlords to make sure that our expectations for health and safety on campus extend to the off-campus environment as well. I want to take a few minutes to talk to our new students. We're excited for you to join us later this week. And in the middle of this week, you're going to be receiving an email from us about our fall welcome activities, as well as our websites will have some updated information. While our fall welcome will look different, we're still very committed to providing a welcoming environment for our students to make sure that you understand the expectations of being a BGSU student, what life is going to be like both in the classroom and outside of the classroom. You'll have an opportunity to connect with your academic program in college, and there will be virtual opportunities, but there will also be some small group in-person opportunities. We're also excited this year to include an introduction to life design principles, which will really be a key component of your 4 years here at BGSU. For our residential students, I know you've been getting a lot of information from us. Our new students will start arriving on Thursday and move in. We'll continue through Saturday. Our returning students will begin arriving on Sunday through Tuesday. The move-in process, you should have gotten information, and hopefully you have signed up for your move-in time. If you haven't, I encourage you to contact Residence Life on Tuesday, because it's really critical that you have a designated move-in time. We are really trying to manage the number of people that are coming into residence halls, and we want to make sure that we don't have a lot of people arriving at the same time. I know that there have been some questions and concerns about the assistance that you might have from family members. We are limiting students to one guest who can help them during move-in. We do understand that that can be challenging, but again, we are trying to be very mindful of the number of people in our residence halls. And so if you have perhaps two people come with you, they'll need to swap out so that one is always waiting outside in the car or your vehicle, because only one will be allowed in the residence hall. Again, it's a safety measure that we are taking. Some of the other health and safety protocols that we are following relate to our residence halls will not allow guests for the near future. That is something we will continue to look at as the situation in our region and our state continues to evolve. Again, that is meant to be a health and safety protocol to keep our campus safe. We will have increased cleaning procedures in all of our buildings. And I know we've been getting a lot of questions about, so what space is available outside of my room? All of our lounges in the residence halls will be open, but we will be reducing the occupancy in the lounges. We've moved out furniture, we're limiting the number of people in the spaces. Also, things like the computer labs and the laundry rooms will still be available, but will have reduced occupancy. And we do have kitchens in the residence halls that students can use, but it will only be one person at a time. Please keep in mind that we will have cleaning supplies available so that you can clean the facility when you go in, so you feel assured that you're in a safe environment, but we also ask you to clean it when you're done. With regard to our dining halls, all will be open, but there will be some restrictions. Tables have been removed so that there is more physical distancing. There will also be a new entryway process to, again, support physical distancing. Our food stations will no longer be self-serve. They will be managed by a dining employee. But we will continue to have both dine-in as well as extensive to-go options for our students. One of the last things I just want to touch on is really directed to our parents and family members. This is not necessarily new, but it has a different feel to it this year. So I really feel that it is critical that the student, their family, their supporters, and the university are in a partnership so that we can achieve student success. And that to me feels even more important this year. Certainly the student bears the brunt of that, but the way that parents and family members support our students, so important. The way the university supports our students is so important, and we want to work as a team. Parents and family members, I want to share something that I probably have said countless times as you get ready to send your student off to BGSU. If you haven't had a conversation about expectations, I really encourage you to do so. Now, those conversations often center around things such as finances, the expectations of academics, alcohol use, and how often you want to stay in touch. But I'm going to ask that this year you also talk about your expectations regarding our current situation around COVID. And I think that that is so important because the decisions that we are all making as individuals not only impact our ability to be successful here at BGSU, but the decisions that we are making also are impacting those around us. The actions that you are taking or not taking, the things that you are deciding to attend. A large party might sound like a really fun idea, but the implications are really significant. So I really want folks to think about that. And if you haven't had those conversations, please have those in the coming days. And I don't think those conversations are just for new students. It's also for returning students because we all grow and change, and it's important to revisit that. So ultimately, we are all moving towards a student success here at BGSU. At this time, I'm going to turn things over to Ben Beatty, our Chief Health Officer.
Thank you, Jody. Good evening. I want to talk about the health protocols that we've put in place that will be functioning across campus. So as we navigate this fall semester, it's going to be very unlike anything that we've seen on campus before. We have worked diligently to enact all of the Ohio Department of Health mandates for higher education, and we have also worked to meet or exceed all of their recommendations as well. And so as we look at a day in the life of someone on campus, whether it's a faculty, staff member, or student, we're going to start our day by asking them to screen for symptoms. Essentially, look for the symptoms of COVID-19 and immediately stay home and isolate if any of those symptoms would appear. We're going to have a screening tool in place that will actually be able to assist everyone on campus to do this on a daily basis. So they'll get a reminder to check the boxes to see if they're having any symptoms. And if they would flag at all that they are, we're going to ask them to stay home and contact their medical provider. It's more important than ever that for this fall semester, every student has connection to a medical provider. So if they don't have a primary care provider in the area or somebody that they can readily get a hold of, we want them to contact Falcon Health and set up that relationship early on this semester. Because at any point, any one of us could wake up and we might have a slight cough or congestion or a headache. And this year, it's more important than ever that we actually are able to talk with that medical provider and screen out and say, is it potentially just seasonal allergies, or does it warrant being tested for COVID-19? Falcon Health is ramping up capacity to actually provide telehealth visits as well. So we can do this in a much quicker fashion, and an individual doesn't even necessarily have to go in to the facility. So then at the same time, we're going to look to say, if someone needs to stay in their room, we're going to work with them because we want to make sure that we're supporting them in those functions. So whether if it's a faculty or staff member that maybe can stay home and work remotely that day until we're able to get in with that medical provider and figure that out. For a student, that may be the day that they do remote learning or synchronous learning because we've created these flexible options for students. At the same time, we want them to notify whether if they're in the residence hall, their hall director, so that we can work with them, or if it's faculty or staff, that they're notifying their supervisor so we can work with them as well to make sure that we're being proactive and not waiting to see 5 days down the road when somebody would get a positive test result back. So we do have situations in place where we will be able to work with individuals to do what we call contact tracing. So if an individual would test positive, we have isolation space that we can move them to at an apartment complex owned by the university, where they will be able to be isolated and supported in that environment. We'll have dining, able to deliver meals, whether they're needing to quarantine within their room because we're waiting to see on a test result, or if they're in that isolation space, dining will be delivering meals during those situations as well. They will be getting regular check-in phone calls from a hall director or someone else on campus to make sure that they're doing okay. If they need a telehealth visit with Falcon Health, we'll be able to arrange that for them. If they're struggling with isolation or quarantine or even just being away from home, we have telemental health available through the counseling center to assist people in those fashions as well. And then if somebody would need an in-person visit, we can arrange that as well to do that safely to make sure that they're getting screened if symptoms would start to worsen or anything along those lines. At the same time, we have built an entire protocol around campus to really limit interactions and contacts in 6 feet of physical distance. We know based on the CDC's guidelines that somebody is a potential exposure or contact of a positive case if they're within 6 feet for greater than 15 minutes of an individual who would test positive during their contagious period. So across campus, we've worked to recreate our environment so that people just keep and maintain this distance. One of the things you'll see as people leave their dorm rooms or we come onto campus are these face coverings. As you're seeing each of us wear these tonight. And the reason we're wearing them tonight is because we're in an indoor public location with other individuals within these studios. So the standard across campuses, if you are in an indoor location, you will need to have a face covering on unless you are in your own personal space. So when I'm working in my office with my door shut, I can take my face covering off. But when I leave my office, the face covering goes on as I make my way through any building across campus. And this is going to be the same for students. When they come into a building in a classroom environment, the face covering will be required, and it will be required of everyone as we make our way through our day. We know that this really helps to slow down the spread of the virus. Even if I'm an asymptomatic carrier, right now as I'm talking, the mask is helping to keep any viral particles from being spread out into the environment, especially if I would cough or sneeze, and we know how that can spread as well. So me wearing my mask is protecting those around me, and them wearing their mask is protecting me. In every classroom, we've achieved 6 feet of distance so that we can make sure that even if somebody would be an asymptomatic carrier or come down with symptoms a day or two later, no individuals in that classroom would be considered a contact or have an exposure because they've maintained that 6 feet of distance throughout the classroom environment. We're also increasing enhanced cleaning protocols in between classes and across campus. So we're regularly cleaning all sorts of high-touch surface areas to make sure that we're keeping up on that. But then we're also asking for partnered cleaning as well. All faculty, staff, and students will have access to increased cleaning materials so that we can do our part, as Jody talked about, to wipe down surfaces that we use. If I would use a copy machine or use different shared public spaces, I can wipe down that surface. In dining, I can wipe down my own table or wipe it down after I leave that space. It'll get wiped down by somebody eventually, but we can all partner to do this and really slow down the spread of any viral contact on surfaces as well. So all of these things are in place to really help us slow down the spread, and we all have a personal responsibility that can help keep us safe. I can choose to go through my day on campus maintaining that 6 feet of distance, wearing my face covering, and doing, following cleaning protocols and having interactions appropriately so that I can still socialize with others, but I don't have to put myself at risk, in any greater capacity. I can keep that risk very limited for myself and who I choose to let into, that close bubble or 6 feet circle. We do know we will have some students that will have roommates based on their request. So they will function as a family unit, just as all of us potentially function with our family unit at home. And so we'll be working with those individuals. Should one of them become symptomatic, the other one would most likely have to quarantine. But that was the purpose of de-densifying, so that if someone becomes symptomatic, they already have a single room space that we don't have to worry about another individual potentially being exposed. So we have many more protocols across campus as well, but we'll be rolling those out for all students as they come. And we're all going to learn this sort of new campus environment and how we can navigate it and keep each other safe. So with that, I think we'll open it up to Alex for any questions that people may have.
Great, thanks, Ben. We're seeing a lot of themes pop up on Facebook, and just a reminder that you can submit questions in the event thread and also at president@bgsu.edu for emails. We're monitoring both. Ben, I think we'll go back to you for a couple of questions regarding health protocols. Specifically, can you clarify the difference between quarantining and isolation, especially for on-campus students? And also, if they have to isolate, where would they do that?
Yeah, absolutely. So I get this question a lot, and isolation is when someone is sick or is tested positive for COVID-19. So we know that you're potentially contagious and could be spreading the virus. And so whenever we come across that individual, that's when we have to try to isolate them as quickly as possible and limit any contacts they have with any other individual. So making sure that they're not within 6 feet of anyone else for greater than 15 minutes that virus could potentially spread. So when someone goes into isolation, the general period of time for most individuals is they have to isolate for 10 days from when their symptoms started. They have to be fever-free for 24 hours, and their symptoms then have to have resolved. So for most people, that averages 10 days. Now, for some people, they may have that lingering cough that just kind of sticks with them, or be struggling, that they're just not recovering as quickly. We definitely want them to work with their medical provider to determine when's the appropriate time for them to come out of isolation. But for most people, that would be that 10-day period. That isolation space will be at Falcon Landing on campus, and so it's an apartment complex where we can isolate people appropriately in that location. And so we can make sure that everyone has a separate bedroom space and they're not at risk for anybody else, and we can care for them in that environment. Quarantine's a little bit different. So quarantine is when an individual is exposed to a positive case, so is that contact. So if I was potentially positive today, anybody that would be within 6 feet of me for greater than 15 minutes would then have to quarantine for up to 14 days from their point of last contact with me. We don't know if they contracted the virus or not, but we're being proactive in making sure that if they would develop symptoms, that they're not spreading the virus any further to anyone else. This virus is tricky because it has a 14-day incubation period. So even if I was exposed today, I may not start to show symptoms until up to 14 days from now. At the same time, we know that individuals can be contagious for up to 2 days before their symptoms start. So by the time, if we didn't put them into quarantine and they felt fine, they might still have interactions and expose other individuals even though they haven't become sick yet. And so quarantine is a period where we're watching them to see, are you going to develop symptoms? Do we need to get you medical care? Do we need to test you to determine if you're actually positive for COVID-19? And would we need to move you into that isolation space?
Great, Ben. We're getting a lot of questions regarding testing, especially as it compares to other public universities in Ohio. On BGSU's testing, it's been in the news that we pilot tested resident advisors and student athletes. Are we planning to test all BGSU students, faculty, and staff? And if not, will students kind of be subject to subject to testing as on a case-by-case basis?
Yeah, so we will not be testing all students upon their return to campus. We have to recognize in working with the public health guidance, these tests are a very valuable resource to the community right now. And so widespread, massive surveillance testing on the front end becomes very difficult in that it reduces that capacity for Wood County and for Northwest Ohio for people who are symptomatic and may need that test in a more ready fashion. So we recognize it makes more sense for us to do some surveillance testing. And when we say that, that's testing large groups of individuals, but probably not everybody. A large enough group that we can say, here's probably our general prevalence rate, and that will most likely be ongoing throughout the semester. Rather than use up 20,000 tests in the very first week, we can spread that testing capacity out over the course of the semester and make sure that we're working in an appropriate fashion to use that valuable resource. So what you'll probably be seeing is we have testing capability through the Wood County Hospital and Falcon Health to test students as they potentially would develop symptoms. So we can know, does this person truly need to isolate at Falcon Landing, or is it something else? Can we rule out COVID-19? At the same time, we'll be doing some sort of surveillance testing to give us an idea of what is our prevalence rate on campus, especially in those asymptomatic carriers, to make sure that we're seeing that us mirror what would be expected to be seen in the general population, especially here in Wood County. And so that'll be the strategy as we move forward. We're partnering with the Wood County Hospital to drastically increase testing capacity as well. The goal is to have ample testing capacity not only for the university, but eventually in this partnership to be able to support Wood County and potentially Northwest Ohio in increasing testing capacity. So we're ramping up in partnership our lab capacity and really looking to roll this out and make this a win for public health for everybody in the area.
Thanks, Ben. Jody, I think we'll go to you next. We have a lot of questions regarding student life on campus, particularly about student organizations. Will they continue to operate this fall? What will Campusfest look like? And how will students, what's the expectation for their out of their classroom experience with those?
Absolutely. That's a key part of our campus. And many of you know that we have been fortunate to have over 300 different student organizations with a wide variety of interests and focus. And so we don't intend to lose those student organizations. And many of our student organizations have re-registered for this year, which is a typical process that happens in the summer. However, what the student organizations are doing and the way that they meet and connect definitely will look different. As referenced several times tonight, we will be looking at smaller group size. Many events, in-person events, will be 10 or under. If there is interest in doing I'm going to say slightly larger event, we will certainly ask that student organizations work with our staff and campus activities, and we will go through an approval process with the guidance of our chief health officer. Now, knowing though that there are those restrictions, it should not discourage our students from joining these student organizations. Our organizations range from organizations that support your academic interests, to social justice issues, to recreational and purely social activities. And we feel that these groups can still function, but there will be some limitations, and many of our groups may be using Zoom now for their regular meetings. Also, I want to reference that our Fraternity and Sorority Life program at BGSU is very strong, and we will continue to grow and build our Fraternity and Sorority Life system. And those organizations will be holding their typical recruitment activities, but those will be virtual, which I know will feel very different for many, but it's still a great way to get involved in many of our organizations. With regard to Campusfest, we will still have Campusfest, but at this point it will be a virtual format because if you've been to Campusfest, you know that we would be well beyond 10 people. And so we will be working closely with our student organizations and encouraging them to participate virtually so that our new and even returning students have that opportunity to join organizations at the start of the semester.
Thanks, Jody. Joe, we're getting a lot of questions regarding the academic experience. First, on academic resources, will the library still be open? Will Learning Commons still be offering assistance to undergraduate and to graduate students?
Yes, thank you. That's a good question. Yes, the library will be open. We'll again practice physical distancing in the library, so there'll be some reconfiguration in the library to make sure that we're as safe as possible. In addition to the Learning Commons will be open also, but as we did last spring, we'll have some virtual tutoring that are also part of the Learning Commons experience. So we'll be able to serve both students who are on campus as well as students who are off campus. And we also have a lot of electronic services that will be provided by the library in addition to the in-person services. So we're preparing to serve both the in-person student as well as the virtual student.
Joe, on the similar track of academics, can you walk us through Design My BGSU, in-person, hybrid, remote, online courses for students?
Sure. Design My BGSU is our initiative to allow a student to tailor their experience at BGSU for the fall 2020 semester. What that means is if a student wants to be fully remote or online, they can do that. Or if they want to be in person, they can do it also, or a combination of both. And I'll come back to a few limitations in just a moment. But the fully online and remote experience will be a schedule composed of online courses as well as remote courses. The difference between an online course and a remote course is that for a remote course, it's an online course that meets at a particular time each week. So it's scheduled meetings between the students in the class with the professor. Whereas the online course is student can log in at any time, review the materials, submit their quizzes, their work and everything. So it's flexibility there in terms of scheduling. The in-person hybrid experience is that it's primarily in person and in a classroom where the physical distancing is observed. So if there are seats next to one another, there'll be signs on one seat that says "Do not sit here," so it can achieve the 6 foot distance between individuals, as well as 7 feet between the instructors and the students in the front of the class. And but in addition to that, it was mentioned earlier, what if a student is quarantined? Well, we can also let that student participate in an in-person hybrid course through technology while they're in quarantine, so as not to fall behind in their studies. And so those are the three different modes. They can be, the extreme is fully online/remote. The other is totally in person. Now there's a couple limitations we have to look at. There are some classes where we just can't deliver remotely or online. And so those classes have to be in person, but we can work with the student to modify their schedule to take those classes at a later time or substitute other classes for those experiences. So again, the key to the whole concept here is flexibility.
Thank you, Joe. Ben, we're getting some more questions regarding our health protocol and practices. First, you mentioned you were talking earlier about testing. Is testing free?
Yeah, so testing, that will depend. So if someone is symptomatic, just like with any other medical test that someone may need, they could go to Falcon Health or another location to get that testing, and that would be billed to their insurance. So testing is required to be covered by insurance. At the same time, if the university would ask someone to be tested potentially for surveillance, then we would cover the cost of that test. You know, if a large group of people needed to be tested in a dorm room, just to give us an idea of, you know, is there any potential spread within that residence hall, then we would cover the cost of that test.
Thanks, Ben. And back to your earlier comments about isolation. For those students who said they would go to Falcon Landing, can they also return home to their permanent address? Can parents come get them?
Absolutely. So, you know, every student always has the option to return home. We want to work with families to make sure that they're choosing, you know, the best option for them. We recognize that, you know, some families may have an at-risk member at home, that would not be the best choice for the student to go home and potentially, you know, expose anyone else. But that's always an option. And so if in your home life, if you have the capability to sort of isolate at home in a section of your house where you would have your own bathroom and your parents could assist you with, you know, providing meals at your door, that definitely would be something that we would talk about and always would provide that option as well. Same with quarantine. If an individual, you know, would be asked to quarantine within their room, there's always that option to go and quarantine at home, and we want to navigate that appropriately for all families and what's best for them.
And can you clarify, you know, practices for isolation for students who already live off campus?
Yeah, so essentially for isolation off campus, that's the same as any other community member. You know, so if anyone within the general Wood County community would need to isolate, they're going to be asked to do that within their bedroom, you know, in whatever location they live within their residence. So if it's an apartment complex, you know, or if it's a house off campus, they're going to be asked to isolate in their bedroom where they're located, and that follows the same protocols as any member of the general community.
Thanks, Ben. We have a question from a parent who's out of state, who sees counties and geographical areas broken down by color for the Ohio Department of Health. Can you expand on that and provide, you know, a status and how to maybe track our region's code?
Yeah, absolutely. So everybody throughout this fall semester should try to get really familiar with the Ohio Department of Health's website. There's a lot of great data on there and a lot of information that can be drilled down for the state as a whole and specifically for Wood County. And so that's one of the measures that we look at as we make decisions in what is our activity levels locally. And so in working with the Wood County Health Department as well, we look at, you know, number of cases in zip codes and kind of really see what are our trends. Are we trending upward or are we trending downward? So when we talk about the public health advisory system for Ohio, you can look at that website and see, you know, the color codes are, you know, level 1, which would be yellow. You know, yellow 2 is orange, which is currently where Wood County stands. Level 3 is red, and level 4 is purple. And so as we progress, there's multiple indicators that get triggered that would advance, you know, the color standing. And so right now for us, it's just general community-wide spread, which is pretty common across Ohio. As you start to see other indicators get triggered, like ER visits going up, or hospitalizations going up, or ICU bed usage going up, that's when you start to move upwards in that advisory alert level. And these are all of the data points that we're looking at, plus many others, to make decisions on what's the appropriate, you know, opportunities for the campus. When would we potentially have to look at saying, you know, okay, now we maybe need to shelter individuals on campus and have some more remote class options as well for a couple weeks to navigate that spread within Wood County. But we'll be working very closely with the state and the local health authorities.
Thanks, Ben. Jody, we're getting a couple of questions about your comments earlier about the student code of conduct, holding students accountable. Especially there's concern regarding students who do not wear a mask indoors and follow the guidance, or those large gatherings off campus at parties.
Yeah, so Similar to other student issues and concerns, the Office of the Dean of Students can manage those issues, and we would ask that members of the community, if you see that others are not in compliance, I think it's really incumbent that we all hold each other accountable. If you feel that there's a concern and that someone is not willing to adjust their party plans or to put on that face covering, certainly you can always file a report with the Office of the Dean of Students. We have a common reporting system on campus. It's called See It, Hear It, Report It, that really anyone can access. And when I say anyone, it certainly can be students, it could be faculty and staff, it can also be a community member. And we've shared this information certainly with members of our immediate community, but also have shared this with those in the Bowling Green community because there are concerns about behavior both on and off campus. When we do receive those reports, we'll reach out to the students and provide follow-up. With regard to actions that will happen, really will depend on the situation and as well as what the student's current conduct status is. But we do have accountability measures in place if we find that a student is not in compliance.
Okay, Jody, and quick follow-up on that. There was a couple questions regarding off-campus and whether the student code of conduct applies to parties and large gatherings off-campus. And also, has there been any work with local landlords as far as collaboration for holding students and tenants accountable?
Yeah, so our student code of conduct does extend to off-campus, and I would just reinforce, I think I said this before, that's not new. We didn't change that because of the current pandemic situation. If you're a member of the BGSU community, we hold you to a certain standard, and whether you're living in a residence hall or you're living in an apartment or house, we hold you to that same standard. So I think that is important for individuals to keep in mind, that they will be held to that standard. With regard to local landlords, we've always had a relationship with, I believe, a good relationship with the City of Bowling Green and our local landlords. That's been in place. We've certainly had some very specific conversations this summer about what things will look like. Our students have been here, but more students will be here by the end of this week. And so we've been working closely with them, and it's not only just our students we want to focus on, but we want to make sure that landlords are setting those expectations with their tenants. And so we've been very pleased with the response that we have received to date, and we will continue those partnerships in the weeks and months ahead.
Jody, one final question before we go back to Ben for additional health questions. With move-in this week, there was a lot of questions about single parent being able to move in their son or daughter to campus, both parents coming into the facility. Can parents switch off and go back and forth? Can you provide some clarification for move-in practices?
Absolutely. So our move-in process is different. As I referenced before, you will need to set a designated time. And if you haven't done that, please contact Residence Life. We really are trying to control having large number of individuals gathered at the residence halls trying to check in at the same time. Our check-in process is also a more centralized process, and you'll be starting at the Stroh Center parking lot to gather some of those key pieces of information and then directed to your residence hall at the appropriate time. So once that happens, we understand that maybe more than one person may come with a student to help with move-in. However, again, trying to be mindful of the number of individuals that we have in the residence halls. And the way that is managed, we will limit assistance to just one person. Now, if you have someone else that came with you and they're waiting at the car, certainly they can switch out, but we will hold to the one guest rule during move-in.
Thanks, Jody. Then we're getting a couple questions regarding parents and families and students who are arriving from hotspot states, if you will, such as Texas or Florida. Are they expected to quarantine or isolate as they come to Bowling Green?
So Ohio has put out guidelines for states that actually have high prevalence rates, requesting that any individual that travels from those states actually quarantine for 14 days upon arrival to Ohio. And the university is actually following those guidelines as well. And so that number of states changes on a weekly basis. So we do want people to refer to the Ohio Department of Health website to kind of keep an eye on their state and where they may be coming from. Because we may have students, and we have had this in the past, students that have arrived to campus who then immediately have had to quarantine for the 14 days upon their arrival. We're going to work with them to make sure that they're able to still do their classes, in an appropriate fashion or catch up, but we are following that guideline for the state.
Ben, there have been a couple questions regarding our recreational facilities, the Student Rec Center, the ice arena. Will those be open? Will there be health and safety protocols put in place for users of those facilities?
Yeah, absolutely. Just like every other building across campus, those facilities have been looked at as well and have been modified to strive for the 6 feet of distance at all times. And we're going to have to control those environments as well. So if you look at the rec center, it won't necessarily just be open-ended like it has been in the past. We may have to have students schedule appointment times for when they come to exercise or use those facilities so that we can control the traffic and make sure that we're able to keep people appropriately distanced within those facilities, maintain the appropriate cleaning protocols, and everything else we need to do to keep people safe.
Great. Joe, we're getting a couple of questions regarding the classroom experience for the fall semester. Have faculty been trained to, with the changing, evolving landscape of online remote classes to improve or enhance their ability to teach for our students?
Yes, another good question. We went through a process this summer. We had, through our Center for Faculty Excellence, we had many workshops that was both in-person and virtual. We also had a conference called the Fall Flex Conference at the end of July, where faculty presented on best practices from their perspective on how we can achieve a better environment and a learning environment in the remote and online mode of class delivery. In addition to that, we actually went through a process with about 75 classes of redesigning the course content called content restructuring in order to organize the material to be more student friendly. And so we have 75 classes that we've done that with and for the fall semester. Also, there are some faculty in different colleges who actually work with one another, learning from each other in terms of how to deliver classes more robustly and enhance the learning for students in those remote and online classes. So yes, we've been doing a lot to enhance the student experience and the faculty experience in delivering online and remote courses.
Great. Joe, we've getting a couple questions regarding internships and co-ops, concerns from students if we were to go online or if something was to happen in the fall or spring, would the university work with students as for internship and co-op requirements, especially for graduation?
Yes, we would. We went through a process this spring that will continue this fall and worked with students individually, along with their college dean and their department chairs, to, if an internship site doesn't accept a student, then we can work with the student to find alternative sites, or in some cases, becoming more common, it's called virtual internships, where a person can do an internship without going to a site. So we'll be working with the students, providing flexibility to meet those requirements especially for students who are near graduation.
Joe, you've talked a little bit about the delivery modes for classes this fall. For context, can you break down like how many percentage roughly? I know you're working through them, but percentages for each of those?
Okay. Approximately 20% of the courses are online, another 20% are remote, and we're about 50% in terms of in-person hybrid. And we're continuing to, again, work with students to tune their schedules in order to customize their fall schedule.
Thanks, Joe. Jody, we have several more questions about the student life experience. With fraternities and sorority life, will Greek recruitment for this fall continue? And also, a lot of questions back to move-in. There seems to be some confusion on where to report for move-in, and also where to just learn more information.
Absolutely. So yes, fraternity and sorority life will still have their recruitment process in the fall semester. That information, particularly for the Panhellenic chapters, is already out there. And I would encourage you, if you're interested or just want to learn a little bit more about the process, to take a look at the Office of the Dean of Students website, because there's information there, as well as how you can register to participate. So that will be a virtual experience. All rounds will be virtual, as well as bid day. And a similar process, for the IFC chapters, they will be doing more of an informal process. There will not be the formal process. And so, again, we're being very cautious about having any large groups gather. And so we'll be using a little different method. With regard to move-in, it will be a different process. If you're used to what you've done before, you will instead be going to the Stroh Center, where we will have residence life staff members there who will greet you and give you some of the basics that you need, your keys, some of the key information pieces, and then we'll direct you to your residence hall. So again, keeping in mind that there are designated times that we want our students to move into the hall so that we can control the number of individuals entering at any point. If there are questions about the move-in process, I would encourage you to take a look at the Res Life website. There are move-in guidelines that are there that are specific to your residence hall, and so it'll reinforce a lot of the things that I just said, as well as some of the directions that you'll need regarding how you enter campus, and having there's something you can print out in there so that you have the appropriate signage on your car. So if you're not familiar with that, go to the Residence Life website, and there's a lot of really good resources that are located there.
Jody, quick clarification question on Greek recruitment. Does that include all four councils, MGC, and PHC as well?
Yeah, so all four councils will have the opportunity to manage recruitment for the Panhellenic organizations. That is all virtual. The other organizations, for the most part, it will be more informal, and fraternity and sorority life staff members will work with them so that they're managing smaller events. And for some of those, while I'm focused on fall, some of those organizations will also have recruitment opportunities to join, or recruitment activities during the spring semester as well.
Thanks, Jody. Got a question regarding commuters. Is there an area on campus or areas on campus for commuters to go in between classes?
Sure. Yeah. So our commuter student population is one that we always focus on, even though we have a lot of students who live on campus, and in fact we'll have even more commuters this year. Some that will be commuting from a parent's home. Maybe they've moved into an apartment or a house here in town. We also know that there will be some students who will be commuting from their home that could be several hours away, but they might be on campus periodically for a lab or some other activity. Keep in mind that the Bowen Thompson Student Union, the library, we also are looking at, we've got some common spaces around campus that can be utilized. And we encourage our students, whether they live across the street or they're going to be coming in from an hour away, to utilize those spaces so that they can get comfortable, take a little break in between classes.
Thanks, Jody. Final question before we go back to Ben. There's a question about counseling. Our counseling services. Mm-hmm. Ben talked a little bit about it. Do students pay for counseling? And what does that model look like to seek counseling services?
Sure. So there is a fee that students are assessed with their other fees that have gone along with your bursar bill for the fall semester. Our counseling center will continue to offer some of the telemental health counseling that they have been offering since March. We will have some staff that will be in the counseling center. However, we will probably be seeing most of our student clients via the telemental health option. Of course, depending on the situation or what their needs may be, our counseling center will work to accommodate them. Also, many students may be familiar with what has been our walk-in process, which is now actually going to be a call-in process with actually extended period of time. And so, the services that we provided, which are so critical to our students, will continue to be maintained. They might look a little bit different, but we also know that some of our students would prefer that method versus face-to-face in our current environment.
Thanks, Jody. Ben, we're getting a couple of questions still rolling in about our health protocols, specifically regarding on-campus residences. Are sorority and fraternity houses considered family units? Those are set up differently than our traditional residence halls, or how would that be broken down?
Yeah, so they should function really very similar to the traditional residence halls. Trying to maintain space as much as possible, even amongst the individuals that live there, because we don't want to get ourselves into a situation where the entire fraternity or sorority would have to be quarantined. And the way that we can avoid that is by still maintaining some space. So even you may have a roommate, we know that you're going to be kind of close contacts for sure, but being able to still have those social interactions but keep that 6 feet of distance is how we're going to work to really avoid having a whole fraternity or sorority have to be quarantined potentially, or be tested.
Thanks, Ben. A couple more questions on that same track. Are students who live on campus, can they go home on weekends, or are they committed to living in Bowling Green for the fall semester?
So we will never, keep a student from going home. Much like we talked before, is every student has the option to make decisions for themselves based on conversations with their family, what their potential risk levels are. We do want to make sure though that if you're having that conversation and there's an at-risk member at home, we want to be mindful of that and really kind of navigating these things appropriately. For some students, especially as we approach the end of the semester and we know they're going to be going home for Thanksgiving, they're going to be seeing extended relatives, maybe grandma and grandpa. That might be the time, those 2 weeks before the end of the semester, that you really start to kind of quarantine a little bit or lay low within your residence hall before heading home, and being mindful of that. But honestly, if at home, you assess your family's risk as being low, then yes, they certainly could go home on the weekends.
Thanks, Ben. And a couple additional questions, maybe for clarity, regarding isolation and quarantine with coordination of meals. How will that work in those situations?
Yeah, so through residence life and dining, anybody that would need those meals, we immediately can basically put that message in to residence life, and it will be automatically coordinated. There's a whole system in place that they'll be able to select their meals. The meals will automatically be set up for a standard period of 14 days. We recognize that most students wouldn't need the full 14 days of meals, but that is what it will be scheduled. And then the student can cancel the meals at the end of whenever the end of their quarantine period or their isolation would be. And so that is worked out that they don't have to worry about leaving their room to go find dining options.
Ben, we're getting a couple of questions regarding masks. Will the university supply masks to its students, faculty, and staff members? And also, what types of masks are permitted? There was a couple comments here about vented masks or masks with valves. Can you provide some clarity?
Yeah, absolutely. So those 2 points, the university actually will be providing a mask to every single faculty, staff, and student member. And so there's going to be sort of a care package that you're going to get at the start of the semester. I heard that 20,000 care packages have sort of been packaged, and really there'll be hand sanitizer in there. There'll be some materials, information materials, along with a BGSU mask that will get everyone started. But we definitely want all students students to come with an assortment of masks so that they can sort of maybe even state their personality with what they wear, because we do need to wash them and have them in rotation. At the same time, we definitely want to stay away from those vented masks. The CDC just came out and said any of those masks with vents we want to avoid, because the vented mask actually allows me to breathe out through it. You know, it does provide, that's more built for protecting breathing in of things, but the mask purpose for us is to prevent breathing out. And so if you have that vent and the airflow can come out through that, it sort of defeats our purpose of allowing for, you know, protecting each other with the masks.
Thanks, Ben. We received a couple of questions about previous communications where the university has stated that it's going to expect students, faculty, and staff to self-monitor or conduct self-wellness checks. Can you expand on that and offer clarity on what that's going to look like this fall?
Yeah, that's our first and foremost responsibility for everybody who comes onto campus. That every morning we sort of need to do that self-wellness check. We're going to have an app available to assist people in this, you know, if they choose to use it, but we want to get as many people using it as possible, because it can be easy to become complacent and just run out the door. So truly, that's an opportunity for everybody just to take a minute before they run out the door to say, you know, am I experiencing any symptoms, or, you know, do I have a fever today and did I check? If somebody does, we know that there's times you're in a rush and you know, you may run out of your dorm room. We're also going to have thermal imaging scanners across campus at different high traffic areas, you know, in the residence halls, or also, you know, in the student union, in the library, so that when somebody enters that facility, the goal is to allow them another opportunity to potentially check their temperature in a very quick fashion. And if they would flag that they have a temperature, we just want them to go home and follow up with their medical provider, or go back to their dorm room and follow up with the medical provider to assess what's going on there. But the Campus Clear app that we'll be using will be readily available for everybody, and the goal is to get as many people as possible using it, so we have high rates of people who are doing the appropriate screening, because that's our first line of defense, is just to stay home if you're sick.
Thanks, Ben. Joe, we have some additional questions regarding academics, specifically relating to the Design My BGSU initiative. Can students work with the Design My BGSU team, their advisor, and fill out the form after the semester starts, or are they locked in if they do not fill out that form before the semester begins?
The form is still active on the advising website, so students can now still sign up for Design My BGSU, and they can also talk with their advisor, and the advisor will then also give them direction on how to engage the team that's leading the effort for Design My BGSU. We would like for students to work through that central port, so that we can keep track of things and make sure that we're having the maximum flexibility for them to design their experience.
Thanks, Joe. We also get a lot of questions regarding technology in the classroom. Are professors using programs like Zoom, WebEx, Teams, Microsoft Teams? And also, can you provide an update about BGSU Sync, the pilot program for this fall?
Sure. Yes, all of the above. But many faculty asked for Zoom, but if you recall, months ago, Zoom had a security issue. They've upgraded their technology now, so that now we have a new version of Zoom that we launched August 1st. And so now we have Zoom capabilities that comes along with it. I'll also add too that we're installing cameras and microphones in the classrooms too, a couple of hundred classrooms, and so that's well on the way. It's scheduled to be complete before August 26th. And what was the other part of the question, if I may ask?
Update on BGSU Sync.
BGSU Sync. Yes, we sent a RFP, request for proposals, out to campus. We had a good, robust response from faculty, and we chose 5 to 6 faculty who are now piloting BGSU Sync. What that really means is that BGSU Sync will be classes held in specialized classrooms that have enhanced technology, so that students in the classroom, physically in the classroom, and the ones who are remote can interact more robustly as compared to just a normal classroom. And so we're testing this approach as we go forward so we can expand it and have more flexibility in the classes we deliver and the student experience itself, both in the classroom as well as remote.
Thanks, Joe. A couple questions regarding in-person and hybrid courses. When will students know what days that they will be reporting in person, and how will they find that out? Is it by faculty, by course by course?
By course by course. So the faculty member will get a list later this week of students who may participate remotely. And so they get that list, but the faculty will then communicate to students. If it's a class that's large and half of students meet in person on Tuesday and the other half on Thursday in person, the faculty member will communicate with the students who's in which group, who's in the Tuesday group and who is in the Thursday group. So faculty will directly communicate with the students.
Great, Joe. And a question came in regarding College of Education students, teaching students regarding placements for fall and for spring. If things were to change, would the university work with students as far as case by case?
Yes. We've already had conversations with the College of Education and Human Development Dean, and so they're monitoring the different school systems to know who's open, who will be accepting students and fill placements, et cetera. And so as we get more information, we'll work individually with the students in order to help them fulfill the requirements for graduation.
Great, Ben, we're getting some more questions regarding our health protocol, specifically relating to cleaning. Will residence halls be cleaned and monitored? Same with classrooms overnight. Will facilities be cleaned and monitored?
Yeah, absolutely. There's Campus Ops is doing enhanced cleaning practices across campus. So every classroom facility, there's actually a misting machine that can spray and kill the virus in 30 seconds, and then it just needs to sit for about 3 minutes to dry. And then we've sort of sanitized that environment as well. You'll see individuals moving their way through campus, cleaning doorknobs and other pieces, high touch areas, railings, and things like that on a regular rotation. And then in partnership with that is, the asks that we all do our part in utilizing cleaning supplies and wipes to make sure that we're hitting all of those high-touch surfaces after we use them. So you can't see them here, but even here, if I get up away from this table, immediately it's wiped down by somebody here in the studio so that anyone else that would come after me can utilize it safely and not worry about picking up the virus from contact surfaces.
Great, Ben. We're getting questions regarding air conditioning in residence halls. Should there be concerns with those with central air and with residence halls as far as transmission?
Yeah, so we've worked diligently on that as well. So we've really worked to look at all of the HVAC systems across campus in every building and to upgrade filters to the highest capacity level that they can be upgraded to help filter out any viral particles. So hitting that filter level that really is going to help us clean the air within all of these facilities. At the same time, we're making sure that we're utilizing room space appropriately. We've had discussions with music classes and what does that look like, and what does the air exchange rate have to be able to actually utilize those spaces appropriately in between classes, knowing that we may be projecting further with some of these things. So following all the proper studies and protocols to make sure that all these spaces have been looked at and every building is at the highest capacity it can be for efficiency.
Thanks, Ben. Joe, we're getting some additional questions regarding in-person, hybrid, remote, and online courses. Are student schedules still changing for those who are working with the Design My BGSU team, or those have all been finalized? And then a follow-up is, for hybrid, were those designed to pivot to online if needed?
Yes. I'll answer the last one first. The in-person hybrid courses are designed to pivot to online if needed, as well as, again, to help accommodate students who may not be able to attend class because they're quarantined. So that flexibility was built in. In terms of
the in-person hybrid course is designed to pivot
yes.
to online
yes.
if needed?
Yes. Yes, we can do that. In Design by BGSU, it was designed that way so we can then tailor students to their schedules. Remind me of the first part of the question, please. Okay.
That was it?
That was it?
Yep, that was it.
Okay, all right. I thought it was 2 parts.
And then a follow-up for question about graduate students. Will there, are there courses, since they're small class sizes, are those lean itself to be more in-person courses and comparative to remote or online?
It depends. In some cases, some programs are actually, they're more flexible, and the small classes are actually online, depending on whether it's a course in the arts versus maybe education versus the sciences. In some cases, the courses in the sciences may be more in person than they are online. And so it really depends on the program that the students are part of as to whether they're online versus in person.
And Joe, the second part that you remembered for the question asked earlier, are those students who worked with the Design My BGSU initiative, are those schedules all finalized, or are we still working with students?
Some are finalized, but we're also still working with some students. What we're trying to do is we have the identification in terms of Res Life. We also have Design My BGSU. And so we had to add some classes. We had to move some students around from one mode of delivery to another. But we're 75% complete with the design, with the de-identification, and then we'll circle back to make any needed changes for Design by BGSU.
Thanks, Joe. Ben, we have a couple questions regarding the Falcon community commitment. What does that entail? Does it apply to students, faculty, and staff?
Yeah, it obviously does. It applies to all students, faculty, and staff, essentially anybody that chooses to come on campus. It shows that we're all in this together, and we all need to agree to follow all of the protocols that we've laid out. We've layered these protocols intentionally so that each one builds on the next one to really allow us an opportunity to slow down the spread of any potential virus on campus, and that each person has responsibility to protect themselves from the virus as well. If we all follow the protocols, we'll have great success. And so that's why it's ever more important that anyone that chooses to come on campus really acknowledges that commitment and acknowledges that in choosing to come to campus this fall, they're going to participate with us. We want nothing more than to have a successful fall semester through the full 13 weeks, and that is our #1 goal, to protect these in-person classes, because this is an essential service that we provide to our students, and so we all need to work together to be in agreement that this is how we're going to function to make that happen.
Ben, a couple additional questions regarding positive tests. Will parents be notified if their student tests positive or is hospitalized? And also, if there is an outbreak or if a large number of students test positive for COVID-19, well, how do we plan to manage that as a university?
Absolutely. So first and foremost, I would encourage all parents to work with their students to again get connected with a primary care provider or Falcon Health early on in the semester. It's ever more important that that student would actually sign the appropriate forms allowing a parent to be eligible to receive medical information if needed. And so if that form is not on file because of HIPAA, Falcon Health or any other medical provider would be unable to provide that information to a parent if needed. There's aspects where we can help on campus with this. You can have a conversation with your student as well around designating a medical power of attorney, that in the event that somebody would have to make decisions for them medically, we want that piece of paper on file so that can happen quickly, and we don't have barriers to that potential conversation happening after the fact. At the same time, when we talk about potential for outbreaks on campus, we're going to have to assess what that looks like and what that means for the campus as a whole and the community as a whole. If it's an outbreak in a particular residence hall, let's say, we might have to come in quickly and test everyone in that residence hall to try to quarantine or isolate appropriately and slow down that spread. At the same time, if we would find campus-wide activity or campus-wide outbreaks, we would have to have further conversations around what does that look like. We want people to recognize that this is a very different environment than how it was back in the spring. Back in the spring, campus was shut down and students were sent home because widespread cases weren't all across Ohio like they are now. And so that was an appropriate reaction at that point in time to keep people safe because the virus was so new and we were still learning a lot of information about it, but we knew we could send students home safely. In our new environment, if we had campus-wide spread, it may not be the best idea to send every student home to their families and potentially expose more individuals in other communities and other areas. We may have to shelter in place on campus for a period of 2 weeks or so that we can see that the numbers come down and we can do that appropriately, still recognizing that every student will always have the opportunity to go home if they so choose.
Ben, there are a couple questions regarding residence life and health protocols, especially around community bathrooms for those residence halls who are not single bathrooms. Are those bathrooms being cleaned? Has there been enhanced cleaning measures?
Yes, absolutely. All of those bathrooms will, just like multiple other areas of campus, will have enhanced cleaning schedules on a regular basis. At the same time, all of the same protocols across campus apply within those community bathrooms as well. Maintaining 6 feet of distance, appropriately throughout the use of those bathrooms. Luckily in some of them there's already natural barriers, when you're showering or things along those lines. But making sure that all of the protocols still hold within those spaces as well. But then yes, there is that enhanced cleaning as well, just to help with any sort of viral contact in those locations.
Ben, a couple questions regarding Falcon Health Center. Will flu shots still be available at Falcon Health as we enter the fall and potential heightened flu season? And then how would student insurance also qualify for Falcon Health Center?
Yeah, absolutely. So student insurance would definitely qualify for Falcon Health Center. At the same time, most likely we'll be promoting flu shots across campus and looking at ways to make that easy and accessible for all students, faculty, and staff, recognizing that we certainly would not want a really difficult flu season in the midst of navigating coronavirus. So if we can get those flu shot rates up across campus, it's going to help us to navigate the entire rest of the semester as well.
And Ben, quick clarification question regarding testing. What type of test would be used, especially if the university asks a student to get tested?
Yeah, absolutely. So right now, what we're utilizing in partnership with Falcon Health is what we call a PCR test. So it's usually a nasal swab or a nasopharyngeal swab, but for the most part, we try to do it with the nasal swab because that's the least invasive, and an individual can administer that for themselves. At the same time, the PCR test is a very highly accurate test. It's sort of the gold standard right now for coronavirus testing. There's been a lot in the news around rapid tests and a potential for false positives. We saw this with the governor that had a rapid test. It came back as positive, and then 2 PCR tests done in Columbus came back as negative. We're using that more accurate PCR test at this point in time. But then also looking at, as new testing modalities come out, being adaptable that if we find a rapid test that can be implemented with a high accuracy rate, we're going to want to be responsive and potentially utilize that as well.
Thanks, Ben. We had a couple of follow-up questions regarding the HIPAA form and POA forms. Can you provide some clarity regarding that?
Yeah, so essentially, the HIPAA form you're going to generally find with your medical provider. So we can, that's where you're going to want to talk with your medical provider because they'll have it on file. Whenever you establish care with an individual, there's a form that you can fill out to designate anyone who may be able to have access to your medical information. And so you want to have that on file early with working with that medical provider. For the medical power of attorney forms, I believe that we can have some language on our website. I think it might already be there, but we'll confirm that. And if not, we'll get that language on there so that we can assist families in looking at that ahead of time as well before their students come here on campus.
Ben, before we kick it to the president for some final comments, do you just have any final comments, and then we'll go to Joe and Jody first?
Yeah, I mean, I think I'll just close with we in public health, early on when we all sheltered at home as a country, we proved that we can control the spread of this virus. We know that by limiting, large gatherings or close contacts with others outside of our own home, we can drastically reduce the spread and really flatten the curve. We now need to prove that we can open campus, and with the proper protocols in place, we can keep that curve flat and that we don't see spikes in cases. But it truly is a personal responsibility for each one of us to look out for the other members of our community so that we all can be successful in this. We're going to continue to work with everyone, answer questions. We will have we're already formed a COVID-19 response team where all individuals will be able to either call or email questions, and we'll be able to get a response to their questions as we navigate this. We'll be doing weekly updates as well to let everyone know of, what are we seeing on campus? Are there any protocols that have had to change? How have we had to adapt and be flexible? And are we having spread on campus to that people should be aware of so that we can all navigate this appropriately?
Again, we're all this together. If we think about one another and we think about the safeguards, think about the physical distancing, think about the face coverings, not just to protect ourselves, but to protect our friends and neighbors and families. If we think about it that way and we continue to do the things that we need to do to make it as safe as possible, we can make this a successful fall 2020 semester, and we can help both the young people coming in, new students as well as returning students, keep making progress toward their degrees and go out and become productive citizens in society in spite of COVID-19.
So over the summer, as I've had a chance to talk with various students, I know that many students, both new and returning students, are excited to be on the Bowling Green campus, and we are excited for you to be here. I think at the same time, though, I want to stress, as my colleagues have, that this really is a collective effort. We will get through this, but the decisions that we make, the actions that we take, or those we decide that we won't take, really will impact not only an individual, but the wider community. So I really encourage all students to think about, as they return to campus, the responsibility that you have, not only for your own success, but for the success of others as we travel through this fall semester. Thank you.
So thank you so much for joining us this evening. I certainly want to thank my colleagues, Joe Whitehead, our Chief Academic Officer, Ben Beatty, our Chief Health Officer, and Jody Webb, our Chief Student Affairs Officer, on sharing the planning that has gone on over the last few months as we prepare for your re-arrival or new arrival into Bowling Green State University later this week and next week. We ask you again, and we appreciate the fact that some of you are still waiting for schedules, final schedules, and for those students, we just ask for a little bit more patience. I can tell you we've got individuals that are literally working throughout the evening, working on finalizing those schedules, working with faculty members, and want to certainly thank the faculty members that have been flexible and certainly working with their deans and department chairs to meet the needs of our students. So I ask you just for a little bit more patience on that schedule as we work through. Although I know the vast majority of you do have a schedule, but I ask for a little bit more patience. I know there's been a lot of questions about testing, and I can tell you that we are working with our partner, Wood County Hospital, and through their labs to make sure that we have the resources we need to do appropriate level of testing. Some universities have announced that they're testing everybody, maybe twice, 3, 4 times a week. We feel that that doesn't meet CDC guidelines or Ohio Department of Health or Ohio Department of Higher Ed kind of standards. You know, they talk more about surveillance testing, and quite honestly, it's a scarce resource. As Ben said earlier, it's a very scarce resource, and we want to make sure that we are using these testing resources in the most effective way to manage the health and safety of all members of our community, students, faculty, and staff. It is incredibly important that we do that. But I tell you that each day, and we had meetings today as we work through making sure that we have all the capability. So for those individuals who need to be tested or want to be tested, that we have that capability to be able to deliver that to you in a very timely way. There's been a lot of questions about, well, there's other schools that have said this, they're doing this or that. I will let you know that here at Bowling Green State University, I want to just let you know that we each week, and more often than that, typically I have conversations with other presidents of the publics here in Ohio, and each week all of the publics get together, making sure that we are all comparing what we're doing to ensure that we're doing things that protect the health and safety of all the members of our community. And while some schools have delayed when students are moving in, they've moved in some students and have delayed others. At Bowling Green, we have also done this phased approach. But what we've done is we've really left it up to the students. We've asked you, what are you comfortable with? If you want a fully remote virtual experience, we will work with you to achieve that. And that has de-densified our campus. Whereas other universities make that decision for the student, we are empowering the student to make that decision. But here's what I also want to say, that, and we've given that same flexibility to our faculty. We've asked our faculty, if you've got some underlying health conditions or you have concerns, we will work with you to find a way that you can teach your class, whether it be synchronously in a remote environment or in online. So we're treating and our staff members as well. So we are trying to work with everybody in our community. But to each of our students that are with us tonight, here's what I want to ask you. And it's more than an ask, because we will all depend on each other. Each of us will impact others. When we wear a face covering, when our colleagues that we're meeting with, they're wearing a face covering. When we have the 6 feet of distance, we have minimized the spread of this risk. We know that. We've learned that over this last few months as we studied this, and we're going to learn even more. And I assure you, the reason we have a chief health officer at this institution is to make sure that we are constantly in front of the science and that we are being informed by what we are doing here at Bowling Green. But here's the commitment, the requirement that we need from each and every member of our community. And that is each of you, our students, but it is also our faculty and staff that are teaching face-to-face in some components. We are going to wear face coverings. We're going to keep our social distance, our physical distance. We need to do this as a community to get through this next 13 weeks together. And if we do that, we will minimize the risk. Some initial testing we've done had a prevalence rate of less than 2%, as we did some new residence hall assistants and some athletes and across. So our prevalence rate is pretty low right now, much lower than the state average. But to keep our prevalence rate low, it will be important that each member of the community do what we ask you to do in that commitment. That is our requirement. We do those sorts of things, we can still have a very successful fall term where we're working together, meeting, learning from each other, having small groups. They won't be the large groups, but they will be the small groups in a safe environment, in a reduced risk environment. We do all of those things, and I believe we will have a successful fall term together, because we are Falcons, We are moving forward, and I ask each of you to make sure that we uphold our commitment to each other to ensure that Bowling Green State University continues to be a public university driving the public good. Each of you, I thank you for joining us tonight. I ask you to continue to bring questions in. The President's president@bgsu.edu, or please contact Student Affairs or Student Life or the Provost area or our Chief Health Officer with specific questions. I cannot wait to see so many of you back on campus. I know many of you have also chosen to do the remote, and I look forward to the opportunity to perhaps see you in a virtual experience. But at some point, we're going to be all together back at Bowling Green, and I look forward to that time. Again, thank you so much for joining us this evening. Have a good evening.